Of her.
Okay, start over, sorry.
This is one of our patients that had Dupuytren disease, a contracture of her ring finger that she's now 4 weeks post-op. If I remember right, your finger was pretty well contracted like this, wasn't it, prior to surgery?
Yeah. Mm-hmm.
And the operation was one that we have to remove the diseased cord. But I wanted to show patients particularly what might happen at their 4-week follow-up. I'll always explain to them that the skin and the scar looks very dense and thick, very almost unyielding, but I would ask our patient here, like, how's it been over the past 4 weeks? Has it gotten better? Is it getting more loose? Like, what kind of post-op recovery have you had?
Yeah, it never hurt. I never had any pain. More than anything, it was the swelling in the last week that was kind of bothersome. And
Taking out sutures, does that bother you much?
no. Mm-mm.
Do you remember counting how many you had?
I think I had 14 or something,
Probably
more than I
that.
thought.
Yeah, a lot more. So make a fist for us. And so this is what we kind of typically want to see, even though you might have some splinting that we would do for a few weeks post-op, we want to make sure that you get active tendon gliding and make sure you keep the tendons moving, keep the joints moving so they get the swelling out of the finger. If you turn your hand over, you can kind of see that there's still edema through the hand, and I'll tell patients that this is quite common even up to 6 weeks, maybe a little longer. But as you continue to use your hand and start to use more putty or other objects that help strengthen the hand, that swelling will get better.
Okay. And you said I can lift weights and ride my
Absolutely.
bike?
So you're at the 4-week point now that patients will always ask, well, what can I do and when can I do it? Like, I was always told not to do certain things. Like, well, that's what this 4-week appointment really is for, is that to kind of help you understand that now you've gotten past this acute inflammation phase. We want to start working on the scar. So that means some deep, vigorous massage, kind of working on this in different directions. And I take it doesn't hurt to do this, it just feels rather thick, right?
Right.
Yeah.
Right.
So as you do more of that and you're able to lift weights and grasp and hold objects, that'll help flatten out the scar as well.
Okay.
So when I see you back in 6 weeks, we'll see how much of a difference this actually makes.
Okay. Super.
Okay, so here we are with our patient again. Now we're at 2 months post-op after having Dupuytren's release, and we took a video last time. You can kind of see the difference in how the scar can change. It does still have a kind of a pink purplish halo around it. Still a reaction both from a deeper scar tissue, but also the maturation of the scar. But go and make a fist for me and kind of describe anything change, or what is your feeling about it now, some 6 weeks since we last saw you?
Yeah, it gets better, I think, every week, and I can pretty much do everything that I want to do. I'm ready for the swelling and hardness to go away, but I realize that just takes time.
You've been working with an occupational therapist pretty much on a weekly basis, or?
Try to do it on a weekly basis,
Yeah.
and I have to encourage him to keep going deep in there. I think it sometimes hurts, so you have to realize it's going to hurt, but it's not going to do any good unless it hurts.
Okay, yeah, good advice. How's any kind of numbness or tingling, or you said you have it kind of in a certain location?
Yeah, it's kind of, it's probably the most numb there, and it has been numb just right there, but that's much better now.
Yeah, and your scar goes right across that crease there, and as I think as we
Right.
kind of mentioned in the past, we have to create these flaps that we identify where the nerve runs, but unfortunately when things are tethered up to the skin, those fine nerve branches can get snipped or cut, and there'll be patchy areas where you may not feel
Right.
very well. But
Right, it feels, this is real, I guess it kind of feels thick and stiff. I had a lot of work done on it yesterday, so it's a lot better. And then this is kind of swollen
yep,
still.
and it's still puffing. And kind of, it's hard to kind of appreciate that, but there is some density right through the area that's around the peri-scar, but the scar itself, pretty mobile already.
Yeah.
That's good. So lay your hand
Yeah.
flat.
Yeah.
And then
Which
lift
is,
that
I
finger
could
straight
not
up.
at all do that before.
Yep.
Huh?
Can you lift this off the table? Almost. Do that one. Yep. And then that one. Yeah, so
Hands
still a
on.
little bit restricted because I think largely on this side, turn it over back, it still feels a little tight through here.
Yeah, and when I do like planks or something, I can feel the
Tightness.
tightness more than, it doesn't hurt, it's just tight more
Yep.
than anything.
So as most patients, we'll tell them that you're on track, you're at 2 months since surgery,
Mm-hmm.
And so we'll tell patients about 3 months or so, you'll kind of feel even better to turn the corner. By 6 months, we're hoping that the redness, the halo, the fine line will just kind of be the reminiscent of the scar.
Okay. Yeah, I'm just pleased that I can open my hand again.
Great. All right, we'll see you back in a few months.
Okay.
Thanks. Okay, so back with our patient here now. This is just tracking the way our Dupuytren disease and surgery heals over time. Remind me again, you're about 5.5 months
Right.
from surgery.
Mm-hmm.
Make a fist for me, open back up. So you'll notice that over time, comparatively from a 4-week to 2-month, and now almost 5 to 6 months post-op, how the scar has matured, very fine, soft and supple. It can kind of glide with the normal palm or skin, and really no limitations in function, but you can kind of tell me, like, what are you feeling in your hand, or how does it function?
It feels a little numb in these places right here,
Yeah,
I
the
guess
big
still, but
incisions,
it's not
yep.
really numb, and it feels a little tight, but I can do this, which is amazing.
Yep.
And I can do everything.
Normal grip. Any
Yeah.
kind of tingles or funny feelings in the skin at all, or?
No, not really. It's just more tightness and a little, I guess, numbness.
Yeah.
And it doesn't tingle.
As you can see with the redness from last time, it's largely dissipated, but as these incisions cross the creases of the hand, there are some fine nerves that probably get severed along the way, and so areas where you feel a little numb might be at those corners.
Yeah.
And you only have 5 or 6 months, but this may actually get better over time, where you start to feel different textures and sensations. But
Yeah,
it's
and
quite
I
normal.
think I just need to keep working with it, and I find it feels better the more I work with it.
Yeah.
And I have a little massage gun
Perfect.
that when I start feeling it, I'll just zap it with that for a while, and it feels so much better.
Looks great. And make a fist again. Open back up. Yep. All right. So that's at 5.5 months. Thank you.
Mm-hmm.